Welcome to 10 Kids, 2 Docs. I'm Dr. Vivian Carlin, and I'm joined by my dear friend and co-host, Dr. Sylvia Bank. Between our two households, we're navigating life with 10 children, so we know how chaotic parenting can be. As Johns Hopkins trained pediatricians, we also know the science. Our goal is to bring you the best of both worlds, medically sound, trustworthy advice, and practical, real-world insights as we dive into the trials and triumphs of parenting. Please note this podcast is not intended to be a substitute for medical advice, diagnosis, or treatment from your doctor.
Hi, and welcome back to 10 Kids, 2 Docs. I'm Dr. Sylvia Bank. Today's topic is bedwetting, something that we talk about all the time in the office because it's very, very common, and it's also, from medical terms, referred to as nocturnal enuresis. So why don't we start this episode off by defining what bedwetting exactly is?
Yeah, so technically, by definition, put out by the American Academy of Pediatrics, when we talk about bedwetting, we are talking about kids age 5 and older, because it is just so common for children 4 and under to still not be dry at night. The mechanisms required to stay dry at night often just don't kick in until those older ages. And around age 5 is when we start to see a majority of kids staying dry overnight. But still, there's a pretty high percentage that are bedwetting or having accidents overnight, and that's at age 5, that's generally as high as about 20% or so.
Yes, absolutely.
So if we use that 20% statistic and you and I have 10 children, then we would guess that between the two of us, there are 2 bedwetters. So did you have a bedwetter?
Yes, I did. I had one bedwetter. What about you?
Okay, I had 2 bedwetters, so we were actually hitting 30%.
Right.
Just, again, to emphasize how common it is.
So do you have any specific stories you'd like to share about your experience as a mom with bedwetters?
Yes, well, first of all, let's see. One of my bedwetters was that very classic deep sleeper. And that's not universally true of bedwetting. I know people think of it that way, but that's not always the case.
Yeah, my child that was the bedwetter was also a super deep sleeper. And he would often comment that his sleep was like Minecraft sleep. Or, you know, when you're playing Minecraft and when you go to bed, it's like instantaneous and you wake up the next morning. And he literally describes his sleep as that. He puts his head down and instantaneously his eyes open and it's the next day.
Oh my gosh. I feel like that lifelong skill to have that would be so worth like years of bedwetting as a school-aged child.
Absolutely.
My other bedwetter was classic in a different sense. He had a little bit more tendency towards constipation, which can definitely increase the frequency of bedwetting as well, because, we know anything in that area that puts pressure on the bladder can also interfere with your ability to stay dry overnight. So I will say both of mine did outgrow it. One of them was closer to age 9, even going on 10, and the other around age 8. How about you?
Yes, us too. Our strategies wound up being so good that I actually don't really know exactly when my bedwetter outgrew bedwetting. So one of the things we invented in our family was something that I coined the princess and the pea. So we would have that full fitted plastic layer over your mattress that completely zips up, right?
Yes,
and then
yes.
On top of that plastic layer would be some sort of sheet. And we're not talking like Pottery Barn Kids here or Ralph Lauren. We were talking Walmart, Amazon Basic, like just one fitted sheet.
Oh, right. Yeah, those like Walmart twin sheets. I want to say they're like $3.99 or
Exactly.
something.
And then after that Walmart layer, we would have another plastic layer just kind of sitting on top of that, not full mattress cover, but just kind of like a fitted plastic sheet. And then on top of that, either the Walmart or Amazon Basic sheet. And then we would just kind of layer it. Plastic sheet, just on top of each other. Kind of like the princess and the pea, you think of all the mattresses on top of each other. And then if there were any type of accidents or bedwetting incidents in the middle of the night, because of this layered method, our child would be able to take care of things on his own. So instead of waking us up, telling us he needed to have his bed changed, he would just peel back that layer of Amazon Basic sheet and plastic sheet, and right underneath would be a made bed, and he would just climb back in and then go back to sleep. So we got to this point where he could take care of himself, change himself, get back into bed without us even knowing that a bedwetting incident had happened. And it also gives that sense of autonomy, especially as they get a little bit older, later elementary, maybe even into middle school. They don't have to tell anyone, and the whole incident could be taken care of by themselves.
I love that. That is brilliant. And like I like to do hacks in my parenting that protect my own sleep. So like if I had thought of that and this is a way of my child just dealing with it by themselves and not having to wake me up, I would have totally done this. I love the princess and the pea idea. That's brilliant.
Did you have any other tricks that you used with your kids?
So I will say I work at an overnight summer camp as the physician on staff, and as a result, my children come with me. And I will also say that because of doing that, I realize how incredibly common bedwetting is, because it's like on, 20% of the younger campers' forms, like wet's the bed, don't put them in a top bunk, right? So it's a very common thing. And a lot of these camps have systems in place for how to help kids manage it without being embarrassed. But at any rate, I remember one of my children coming with me, and they were age 7 and was still wetting the bed. And I was concerned, like, oh my goodness, how is this going to go down for a week at summer camp? But at that time, I had gotten this idea of this trick that I had learned from a developmental pediatrician. And she was explaining to me that she advises kids who have more prolonged issues with wetting, sometimes even daytime wetting, but nighttime wetting as well, can switch to using an absorbent pad that's made for adults specific to men or women. And those tend to be more kind of like tight-fitting underwear, or can go right into the underwear if you have tight-fitting underwear yourself. And they're like a little bit more discreet than actually using some kind of overnight diaper or pull-up. For this child, I just pre-placed that nighttime absorbent pad meant for adults into their tight-fitting underwear so that they could use that overnight. And then this child had this relief of, oh, if I have an accident, this thing is so absorbent, right? It's going to catch it. And then I can just discreetly remove it because nobody sees that I'm wearing an overnight diaper. It just looks like my underwear.
Yeah, so another trick that I used, especially when we went on vacation, when we weren't at home, was that I would just take them to the bathroom one extra time. 2-3 hours after they went to bed, I would take that child for an extra trip to the bathroom, just so they didn't have to make the full 10-hour stretch overnight staying dry. It was more like an 8-hour stretch. And as the bedwetting became less and less frequent, then that type of extra bathroom trip right before I went to bed was enough to ensure dryness for the rest of the night.
Oh, yeah, I do like that hack, too, for traveling. And I do discuss that in the office. When you give your child that couple hours of sleep and then wake them up before you go to bed to go to the bathroom, it really does decrease the number of accidents. It doesn't tend to long-term train them. You know, that still is a process that generally just needs developmental time.
Right.
So as we both know, right, as pediatricians, time solves this problem almost universally. So did you do anything else? Did you just wait it out? Did you do any other interventions?
No, I think as a pediatrician, just so reassured that eventually this would resolve. There was no need to make a big deal about it. There was no need to do any intervention than what I already described. So we as a family definitely waited it out. And I don't even think we involved our pediatrician, because as a pediatrician, I knew that this was really normal.
Yeah, I was very much the same. We'll just ride this out. I know it will eventually go away. You know, at some point your children get old enough that they're going to sleepovers and they're frustrated and they're embarrassed. And it was a little bit of that reassurance of I understand, let's troubleshoot this, but trust me, this is going to go away.
Yeah, and by not bringing it up, knowing that it was a normal thing and something that would be outgrown, there wasn't shame involved with it in our household. And it didn't negatively affect that child in any way, right?
Yeah.
So we've had a great discussion about our personal experiences, tips and tricks with bedwetting. Now I'd like to move on and talk about how your pediatrician can be involved and what sort of advice you can get from the office.
So when I think about what is needed for a child to achieve that nighttime dryness, that long 8-hour, 10-hour stretch of staying dry, there's 3 different body systems that have to work together to allow for that. So the first one is the bladder, right? The bladder needs to have the capacity to hold urine overnight so that it can be released all at once in the morning. And if anything is impeding that space, they'll have a higher tendency of bedwetting. So the big one that we see is constipation. I alluded to that. So when I talk to a family about bedwetting, I'm always also asking about constipation. And sometimes parents don't even necessarily know that there's constipation. So so if they don't know, then I ask them to be on watch. Watch that your child is having that goal of that one soft stool every day or every other day. If you're seeing hard balls in the stool, then you know there's constipation. And that might actually be contributing to the space at the bladder. So that's one system. The second is the kidneys. And they are naturally, as children get older, there's a natural increasing release of antidiuretic hormone overnight, which is the hormone that allows the kidney to produce less urine overnight. And sometimes that system needs just a little bit more time to be sophisticated enough to enable that mechanism of less urine production overnight. And then the third one is the brain, which I alluded to with my deep sleeper. The brain needs to be triggering the person to wake up at night to go to the bathroom when they have to go to the bathroom. So while yes, the cliche is that deep sleepers wet the bed, that's a subset. It's not everybody, because all of these mechanisms are working together. And so when a child comes into the office with bedwetting, one of the things we want to do is make sure that there's not some underlying medical issue that we're missing. So why don't we just briefly talk about that?
Yeah. Oftentimes the first thing I want to establish is that this bedwetting isn't a new phenomenon, something that they've been dry for a year or so and then all of a sudden start wetting the bed. Having accidents can be a red flag for a urinary tract infection. So that's one thing I like to establish in the history. Sometimes it can be an early sign of a yeast infection, or very rarely it can be an early sign of diabetes. So when that comes into the history, I will collect a urine sample in the office and just do some quick tests to rule those things out first.
Yeah, and thankfully a simple urinalysis in the office, just that few-minute test can give us a really good indication of if there's any red flags or anything concerning in the urine.
Right. And secondly, I go through a little bit more of the daytime dryness, where we review if they have accidents during the day, what those patterns are. So we talk a little bit about daytime dryness as well. And then finally, which you talked about, we review constipation and how that can affect bedwetting.
Yeah, so mentioning it to your pediatrician is never a bad idea.
Actually, I've seen bedwetting emerge in a patient who was suffering from seasonal allergies when we started recommending taking a non-sedating antihistamine like Claritin or Zyrtec, where they weren't wetting the bed before, but once they started the antihistamine, even though it's not supposed to be sedating, it's supposed to be non-sedating, it was sedating enough where they were sleeping deep enough at that point where they were no longer waking up at night to use the bathroom, and then the bedwetting started after that.
Okay, I've totally seen that too. But yes, when I'm talking to a parent about bedwetting, I think about the things we can do and options for how to manage the bedwetting with the idea of this is a joint decision making that involves how motivated the parent and child are to do something about it. Because there is always the option on the table, which is kind of what you and I both chose, to just continue to use some kind of overnight diaper or system of changing sheets and just wait for time for it to resolve.
So if it's infrequent, like twice a month, every other week, that's one thing. But if they're experiencing bedwetting more than half the nights with wetness, then I usually recommend having some sort of absorbent undergarment for ease of management. And they do make diapers up to size 6. Pull-ups tend to be less absorbent than overnight diapers. And even for older children that are bigger, they can move on to, like you talked about, adult undergarments that are really quite absorbent.
Yeah, sometimes the idea will come up, the philosophy, as to whether or not leaving a child in nighttime diaper overnight is inhibiting that feedback loop of encouraging them to wake up at night. But for a lot of kids, the reality is that they're not waking up at all. I mean, they can wet the bed and then they'll just continue to sleep. And you really just need time for that feedback loop to be helpful. And I do feel like we have to take into account like the balance of if the child is really embarrassed. Like, for example, if they share a room with a sibling and the sibling is complaining about the smell, or if it's just significantly easier and more convenient for the family. There's a lot of different factors to weigh in here. So that concern that you're somehow delaying the outgrowing of bedwetting is a misnomer, and it is okay while they're still having that frequent wetting to leave them in some type of absorbent undergarment overnight. I will say some of these other things are common sense. We want to try to encourage our kids to drink the majority of their fluids earlier in the day and to limit any fluids 1 to 2 hours before bedtime, to avoid any drinks later in the day that are high sugar, snacks with high salt, any caffeine, of course, but all of those things can contribute to the amount of urine production and make it harder to stay dry overnight. And then, as you talked about, another thing that often helps decrease those wet nights is if the parent is motivated to wake the child up a couple hours into that nighttime routine, wake the child up, have the child go to the bathroom, and put them back to bed. After all of those things have been done, the two things that we talk most about in the office for people that want to go even further are alarms, alarm therapy, and medication, which is known as DDAVP. So why don't we take a look at each of those as well?
Yeah, the first one is the bedwetting alarm. Did you ever use any bedwetting alarms?
No, I never did. Did you?
No, we didn't use one either, but occasionally I actually will recommend the alarm in the office, and it requires some explanation. So the bedwetting alarm is a sensor that the child puts in his or her underwear, and as soon as any moisture is detected, it actually completes that circuit, and a very loud, blaring noise alarm goes off. And sometimes the mere sound of the alarm will wake up the child, and they'll stop voiding and then use the bathroom. Like, that's the theory of what the alarm is supposed to do. But sometimes what winds up happening early on is the alarm is going off. The child has fully wet the bed and they're still sleeping, right? So sometimes at this stage, the way that it has to be implemented is that the parents hear the alarm go off. They go to their child's room, wake them up while the alarm is still sounding, and then they change and then they go back to sleep, setting up the alarm again in the underwear for the rest of the night. And eventually, the theory is that the child will hear it and then take care of themselves on their own at that point, where once they feel that first drop of moisture, the alarm goes off, the child wakes up, the child then goes to the bathroom to void and then goes back to bed dry, right? So that is kind of how the alarm sometimes has to be initiated and implemented.
I think that's funny. I think it's one of those things where it's a decision based on the parent's motivation to do this, as well as the child's willingness to do it and readiness to do it, because it does require work on both parts. I will also say it may also be affected by how many children you have, and that might be why neither you or I did it. If I only had one child, I might be tempted because they are really actually very effective. But I do tell people, I mean, when we're talking about them being effective in training the child to not wet the bed, we're talking about like in that 3 to 5 month range, not necessarily a week, maybe a week, but I wouldn't set your expectations that it's going to be that fast. And like you said, it really is an investment of time on the parent.
Right. So the next thing that we sometimes do in the office is prescribe a medication called DDAVP.
Yeah, so DDAVP is a medication that causes the body to reduce the amount of urine that is made overnight. It only lasts for that one night, and it doesn't have any lasting effect as far as training the child's body to not make urine at night. So I think where it's most commonly comes up is in specific settings. You mentioned travel, overnight sleepovers is another one. These are all very reasonable options for using DDAVP. Now, I personally, with my kids, never use DDAVP, but I've certainly prescribed it for patients. How about you?
Yeah, we have never used DDAVP in my household, but I too have also prescribed it. And when I do prescribe it, it comes with a caveat that it doesn't always work on everyone, right?
Oh, yeah, that's such a good point. As we were talking about it, was just pulling this up on the Bright Futures Healthy Children website. And they make that point so that parents know. And the stat they give is that it works in 40 to 60% of children, so in about half.
Yeah, and then I definitely caution the parents, if they're giving their child DDAVP, to watch the excessive fluid intake after the medication is given. If the body is not regulating the fluids because of the medication, you can overload with too much fluids, and it's a caution for parents that it's not to be used every day.
Right, right. Yeah, the scenario in the office when I most frequently see people considering it is that older child, maybe preteen, maybe even early teen, who is still having bedwetting, is very responsible, very motivated, and wants to use it for sleepovers.
Yeah, definitely.
We haven't talked about percentages yet extensively, but let's do that. So, we said up to 20% wet the bed at age 5, and then that just continues to drop steadily. So by age 7, we're generally down to about 10% or less. By age 12, we're at about 3 to 5%. And I have even learned from my urology colleagues who I've asked about this, even if at age 12 they are still wetting the bed, it's typically that when that child starts to go through puberty, they almost universally outgrow it.
Yeah. Sometimes I see in the office when discussing bedwetting with a family, there's a lot of parental anger and shaming of their child for bedwetting, and I highly discourage this. Hopefully we've outlined in this episode how it's beyond the control of the child, to set the stage and that the parents understand that it's a very common phenomenon for kids, and removing that shame or embarrassment really helps overall. So we've reviewed both our personal experiences with parenting bedwetting, our recommendation as pediatricians in the office. Now let's move on to the summary of our thoughts from today's episode.
Yeah, so first off, bedwetting is very common. It's not something that your child can control. It is something they will almost universally outgrow. So like with so many things in life and pediatrics, time is almost always curative. We just don't know how much time. But in the meantime, there are things that we can do. We certainly want to make sure they're voiding regularly during the day, going to the bathroom. We want to address any constipation. We want to encourage the child to drink fluids in the morning and early afternoon hours, and then limit the amount that they're drinking 1 to 2 hours before bedtime. We want to avoid any caffeine, salty snacks, sugary beverages at that late night time. For parents that are motivated and willing, waking your child up when you as the parent are going to bed can certainly increase the chance that they'll be dry on that particular night. It is very reasonable to keep them in an overnight pull-up or diaper until you see stretches of days where they're staying dry. And then for that parent-child combo that are really motivated, alarm therapy is certainly something to discuss with your pediatrician. And DDAVP is an option for those older kids for those unique times when they're spending the night out and want to make sure that they're not wetting the bed.
Well, this has been a really interesting discussion today, Vivian.
Yes, this is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.